Bienvenidos y bienvenidas a MCN Talks, este podcast donde hablamos largo y tendido sobre diferentes temas de trascendencia global. Yo soy Daniel Gómez, jefe de información de MCN, y quiero recordarte que puedes encontrar todos nuestros podcasts en las plataformas digitales y en nuestro sitio web medicalcannabisnews.com. Además puedes seguirnos en Facebook como Medical Cannabis News y en Instagram como MCN Global. El día de hoy hablaremos sobre psicodélicos como agentes terapéuticos. Según la definición del gran investigador Stanish Grof, los psicodélicos son para el estudio de la mente lo que los microscopios son para la biología y lo que el telescopio es para la astronomía. Hoy nos gustaría compartir con ustedes sobre cómo los psicodélicos, cuando son usados de manera correcta, tienen el potencial para curar, inspirar y tal vez hasta salvar vidas. A partir de los años 60, los estudios psicodélicos florecieron en todo el mundo, en los campos de la psiquiatría, la psicología, la neurociencia y la psicoterapia. Esta gran exposición causó a la vez que muchos movimientos catalogados como contraculturales y otros que querían poner fin a la guerra de Vietnam hicieran un uso tal vez no tan adecuado de estas poderosas sustancias. Esto causó que Estados Unidos prohibiera su investigación, lo cual tuvo un impacto negativo en su desarrollo. Después de décadas de oscuridad, la buena noticia es que esta medicina ancestral está de vuelta y, según los investigadores, vino para quedarse. Para esta charla hemos invitado a 3 expertos en el tema de Canadá y Costa Rica. Para el mejor entendimiento de nuestros invitados, pasaremos de hablar en español al idioma inglés. Te recordamos que puedes encontrar el video con subtítulos en YouTube y en nuestro IGTV. Greetings. Thanks for being with us tonight, guys. Can you please introduce yourself and talk a little bit about your work?
My name is Zach Walsh. I'm a professor of psychology at the University of British Columbia, where I do research on cannabis and psychedelics. I've been involved in research on those topics for about 10 years. We've published some epidemiological studies looking at the relationship between psychedelics and partner violence. We've done some work with patient reports of psychedelics, and we're looking forward to working with the BC Centre on Substance Use, developing a trial of psilocybin for stimulant and alcohol use.
Thank you.
Hello, good evening. My name is Leticia Dewar. I'm a psychotherapist and breathwork facilitator, born in Belgium, but also Costa Rican. And I'm very interested in the topic of course, of healing and plant medicine. And I'm very happy to be here.
Thank you for being here.
Well, greetings everyone. My name is José Manuel. I work initially in neuropsychopharmacological research with psilocybin and stress specifically. Well, that didn't really work out. After that, I've been working a little bit in archaeological research of the use of psychotropic substances in pre-Columbian times, specifically for Costa Rica. And I am a researcher with ASEI, which is the Costa Rican Association for Drug Study and Intervention. And right now I'm working on the subject of the possible role of psychedelics in human evolution, along with Dr. Michael James Winkelman. So that's basically what I've been doing. Really happy to be here.
Emmanuel Javog. I'm working with MCN, and I've been involved with them for the last 5 years.
Thank you guys for being here. Please explain us a little bit what are psychedelics, to start.
Okay. Want me to start?
Yeah.
Okay. Well, psychedelics are very interesting substances because they have very low toxicity. They're actually one of the less toxic substances known to human beings, and they do not engender a compulsive seeking of its consumption. But what's most interesting about them is the way they change the functioning of consciousness, of cognition, of emotions, of perception, and they do so in a very peculiar way that it usually only happens when we're dreaming or when we're having like a religious experience. So it's a very special kind of experience that has, I mean, what people like these guys are finding out is that they have a very big potential for therapeutic purposes.
What is the history of these substances? How long has it been around?
Classic psychedelics, drugs like LSD and psilocybin that work on serotonin receptors. Sometimes when people talk about psychedelics, they really focus on those classic psychedelics, but there's other medicines and drugs that can be used called psychedelics. But the classic psychedelics have a long history, but also an interesting recent history. So there's history of use going back thousands of years for psilocybin mushrooms. And LSD, although there's evidence that people were using ergot fungus that had similar effects, also similar compounds in, what are they called? The seeds. The Aztec seeds, what am I thinking of?
Barley.
No, not barley, the seeds with LSD. Morning glory seeds.
The morning glory seeds. I haven't
already do that one. The morning glory seeds. So there's long-term use, but there's also been new refinements. So they're both ancient and new in a lot of ways. We know a lot about them, but in some ways, with the tools of modern science, we know relatively little. Although that's changing in the last few years, there's been a lot more formal study of classic psychedelics and also renewed interest in related drugs like MDMA and ketamine that aren't classically psychedelics, but share some of the same characteristics and some of the same uses.
So why is it today important? Is this like new medicine in the world for certain diseases?
I think so. I think, it's been 50 years since we've had major new medications to treat some very prevalent psychiatric disorders. Things like depression, PTSD, there are drugs that people can use that are effective for some people, but the rates seem to keep increasing and the treatment doesn't work for a lot of people. So it's imperative that we find new approaches to treat these highly prevalent diseases. And the idea that a drug, as Jose was saying, that has very low risk, low risk of abuse, low toxicity, and it can be effective after perhaps a few sessions rather than current antidepressant drugs that people have to take potentially indefinitely and that have very negative side effects. So the enthusiasm, I think, is well-founded because these are big diseases and there's early signals that this could help at least some people. And with a disease that affects so many, even if it only works on 30% of people, 20% of people, that's going to be alleviating the suffering of millions. So.
Sure. And where's the science at this point right now? Like, what do we know from you guys' experiences?
I think the best research now is on psilocybin for a number of reasons. It's quite similar to LSD in a lot of ways, not quite as long-acting. And because of culture wars in the 60s, LSD is very stigmatized. So I think people might be more comfortable with psilocybin, even though the effects are probably similar. And there's some really promising findings, particularly for depression with psilocybin. And of course, depression is like the common cold of mental health. It's so widespread. And the existing treatments are not satisfying. So I think there's some good early signals coming from some very reputable sources, Johns Hopkins, New York University. We're hoping to add to that through UBC, but the evidence is coming in and it's surprisingly strong, even for those of us that are optimistic about it. Everyone's still like, wow. So I think there's a lot of potential. I think in the next decade, and maybe that's even being conservative, we're going to see the use of these drugs in mainstream psychiatry, or at least as an adjunct or an addition to mainstream psychiatry.
I understand that now you can, for instance, in North America, Canada, you can go to certain places and have like this therapy. How does it work?
The only way to get the therapy now, in a way that's totally legal, is through studies. So if you can register in one of the trials. Having said that, there's a long tradition of underground use. And I think some of the underground use with increased interest in the last years is becoming somewhat more above ground. But unfortunately, there's still no legal, reliable access unless you're fortunate enough or connected enough to know the right people. Most people can't access these medicines. So there's a lot of frustration around that because there's promise and people don't want to wait.
Can you tell us a little bit more about the Johns Hopkins in Baltimore and their researchers, because I think they were a very important step for opening other researchers after the papers they published in 2006, what sort of illnesses they were looking to work on based on the psilocybin they were using.
Well, I mean, their research is, a huge chunk of what's known comes from, in the recent years, from the team at Johns Hopkins led by Roland Griffith. They had some early trials of mystical experience, so they have some work with people who weren't suffering and showing how it can affect mindfulness and how it can affect quality of life and actually have lasting change in personality, which is a very difficult thing to accomplish. And some really promising work with depression, end-of-life anxiety. So those are some of the early targets. If we go to the old history, there's been some work with LSD and alcohol that's now being revived, alcohol misuse. So I think there's also promise for addiction. I think increasingly in mental health, we're conceptualizing a lot of problems as one underlying pathology. Pathology of emotional dysregulation, of hopelessness, meaninglessness. And so it could be that it's a common feature to many disorders that is being addressed by psychedelics.
You talk about depression now. I've seen people that are using certain kind of drugs currently available, and it seems to work for them. Like what could be a difference between psilocybin in this case and these prescription drugs that are available right now?
The benefits.
Well, I believe that the drugs that are prescribed, of course, needs to be taken long term and there are some studies that show that there is some negative effect on health on the long term and on neurological functioning. And also, I think that the psilocybin and psychedelics also provide a more integrated and holistic experience than the drugs that are taken, that are prescribed. I think it's a broader and you talked about consciousness. I think it gives more benefits than only the prescribed drugs, right? So I think it's more integrated. Healing takes place.
Yeah, I think people should be allowed to choose. If they want to try those drugs, if those are effective, then that should be a choice. But they should also have an opportunity to take these very ancient treatments, or treatments that are based on very ancient technologies that seem to be part of our, I feel like they're part of our right as beings on the planet to take advantage of this piece of the human puzzle and to be prevented from that and forced into what for some people is a worse option. Just doesn't seem fair. I don't know how that benefits anyone. I don't think they'll replace traditional antidepressants. Maybe they will, but they'll probably be a role for both.
And I think that the fact is that they can coexist,
Mm-hmm.
but right now there is an imbalance because it's all underground, and it means that people are taking psychedelics in unprotected environment without a proper psychologist or psychotherapeutic integration and support. And this is, we don't want any dangerous situation. So we would love, of course, that our society opens up to giving people a safe way of experimenting, as they do now prescribed drugs as well as psychedelics, right?
I believe, being all here in Costa Rica, we know that this is a place that do attract people from all over the world to come and receive some of these treatments, but in a non-controlled manner. There are many places and people who are offering ayahuasca ceremony, iboga ceremony, various mushroom ceremonies, and some of the people who come to visit the places, who come here, come with therapeutic purposes. Right now they're being handled by people who don't have any knowledge, therapeutic knowledge, nor guidelines. Do you think there are any risk for the people who come and do the ceremonies, as they are called, in such a way?
I think people should have a right to the best possible care, and I think the role of a clinician, whether it's a doctor or a psychologist, is to walk beside the patient to help as they make their choices. And people are choosing, obviously, that they want to try these medicines. And the risks are not so great that they should be prevented from trying it. So I think it's been that way with medical cannabis, and it's that way with psychedelics, that the patients are leading the way. And then I feel that the job of of health professionals is to find a way to help those people get the most benefits and the least risks from their use. And if people are doing it in a way that doesn't maximize benefits and that might increase the risks, that is a failure of the health system. So when that, I don't think that people, as soon as they're depressed, think, well, the first thing I'm going to do is go to Costa Rica and drink ayahuasca. Often those are people who have not found success with traditional therapies and want to try something else. And it's unfortunate, it's sad, it's not right that they should have to go so far out of their way. And hopefully they have a good experience. I'm sure some people do, but it's unfortunate that they can't do it in a way that's more affordable and more accessible and just more conducive to healing.
Yes.
Do you guys think there's like a time in your life where it could be risky? Let's say you're 14 years old, 13 years old, maybe you're dealing with depression or something like that. Would that be risky? What are the risks of taking psychedelic drugs in early time of your life?
Well, I would think that using any drug before the brain has finished this process of development implies certain risk. However, if you look anthropologically, for example, there are tribes that use the datura and they give it to children when they misbehave. And it's not like a punishment, it's for them to gain a better perspective of the way their behavior affects the family and the way the behavior affects the tribe. So, I'm not advocating that we give psychedelics to children, but there's also research with LSD and children with autism. So there's also a story of research with psychedelics and young people in the West.
Yes.
But I think that maybe you need to have certain maturity in your psychological. Yourself needs to be sufficiently developed for you to be able to integrate the experience, to navigate it, and have something valuable to bring back for you or for your community or for your family. So definitely we need, it's better if you are sufficiently psychologically prepared, if you're healthy psychologically, but we also work with people that are really disturbed. So one would think that people that are psychologically disturbed wouldn't be that good to give them psychedelics, but we find that this is the case because it increases their connectedness with themselves, with their community. And so the way it works is it enhances certain parameters that can become dampened when you're sick. You feel disconnected from the world, you feel disconnected from yourself also, you don't know yourself. So I'm not sure what the answer to that is. That's what I have to say about it.
Do you guys agree?
Maybe they can elaborate a little bit.
There are traditions, ayahuasca, traditional use. People take it with their families. When we talk about taking it, young people taking it, does that mean taking it together with trusted elders? Does it mean taking it in a hospital? Does it mean taking it at a music festival? Those are all different contexts. We're so early and it's so sensitive of a topic now. We certainly are not going to start with children as the place where you want to do it, but we give children all kinds of terrible medicines when they're very sick. So we certainly give children medicines that are more dangerous than psychedelics if we think that in the end it will benefit their health. But it's certainly, when we talk about taboos, children come up early when we talk about drugs. So I'm sure it'll be a while, but is there something inherently wrong if for a medical reason in using it? I don't know. We'd have to proceed very slowly and carefully.
What do you think, Dr. Walsh, is the obstacles that we encounter in our society and academic world, seeing all the results that the most prestigious universities in the US have shown positive results on the use of psychedelics for different problems that people face in mental health. What is the strongest obstacles and resistance that we have right now to make that big step towards public health?
Well, I think it became part of the culture wars in the 60s, and they became demonized wrongly and unfairly.
Do you think that's still a risk today?
I think it's certainly waning. I think sometimes the sense of that there's obstacles maybe is greater than the actual obstacles. In fact, the FDA has given some speeded up approval to things like MDMA and psilocybin, and you know, it costs society so much, PTSD and treating depression and the loss of life and the loss of productivity. I think that people are ready. I think, you know, if people are ready to look objectively at the results, see what are the real risks, what are the potential benefits, and move forward in a way that's slower than many people would like, but it does seem to be moving forward now. So the obstacles may be, in some ways, our own timidity.
It'd be interesting to know if this openness now that we are finding towards these entheogenic drugs and hallucinogenic drugs to be used in therapeutic purposes might result from the cannabis fight. We started with somehow the most accepted drug by societies, the Western societies at least, and slowly we show the therapeutic aspect of the benefits of these drugs. Now in the United States, it's more than 30 states where it's absolutely legal and used in therapeutic purposes. Many countries in Europe, it's happening in Asia, it's happening in Central America and South America. Do you think that the fact that now people are more open to study other drugs who are perceived to have stronger effect is the result of this opening that we did with the medical cannabis?
I think it created a real sense of possibility, that it could be done. You know, I think it changed people's minds more broadly. It may have even reflected a change in society that we weren't as aware was even there. You know, having legalized cannabis in Canada, I think most people I talk to, the amazing thing is how it really is not such a big deal. It seems, and I think it'll be the same for this. I think, you know, there'll be psychedelic clinics. People might drive by them and say, "Hey, look, there's the psychedelic clinic," or threaten their kids, "I'm going to send you to the psychedelic clinic," or whatever. But I think it'll just be part of the neighborhood, and people who aren't interested in it won't fuss about it. Maybe I'm just being Canadian, but that's what I imagine. I think that it will be front page news for a week, and then they'll be wrapping fish in the newspaper, and people will be going to the psychedelic clinic.
That's interesting, yeah. And like these people that are already going and using this for more like therapeutic effects, what are these effects that they're seeing now? Like more, you guys know any case like directly that can share with us?
Well, there has been amazing studies published about, like Dr. Walsh said, about people who are dying from cancer, which is something very common right now. I think all of us know a person dying from cancer. Is that it becomes so common that, you know, these people need some acompañamiento, support to go through such a difficult thing as it's dying. And psychedelics is an amazing tool to talk about death and to revise and connect with your own relationship with death, and to have a spiritual awakening eventually. So I think that's the beauty of it. And I think, you know, it's all about beauty actually. It's all about the beauty of the experiences that can be provided to people who are really suffering. I think we forget that this is not a recreational thing, this is not a party thing. This is about people who are suffering, and that one of us can be in that situation, and I think people who are suffering deserve the best treatment, right?
I agree.
And I think you were saying something very interesting, Leticia, and about the perception of the psychedelics. That many people who are not aware really or don't know so much about drugs tend to think that the psychedelics are addictive, for instance. But the papers that are being published, the studies that are being made, are actually showing the opposite. It could actually help to fight against addiction. And talking of a big subject now, the opioid addiction that is going on in the United States right now, which is a disaster, one of the ways to actually work against it, to cure it, could be actually these drugs that some people perceive as being an enemy. I don't know if you could, if you know a little bit more about that, or...
Yeah, they were lumped in with drugs that are more habit-forming, but really people don't feel a compulsion. They may have a desire to have the experience again, but you don't see people using these drugs compulsively. One of the best ways to see if you give an animal cocaine or alcohol, it'll quickly learn to press the lever to get more. But if you they'll press the lever to avoid a psychedelic. It's not reinforcing. It doesn't work on those dopamine pathways that are typically associated with addiction. I mean, I think there certainly will be some people who perhaps use more than they should, or the people who do, but it's not something that is overwhelming the healthcare system with psilocybin misusers. And that's despite the fact that they're quite easy to propagate on your own. You can find them, they're not expensive. People still don't really seek them out compulsively. Try to find one of your friends who has a real problem with mushrooms.
Maybe a question more for Jose, who studied the anthropological part of those psychedelics. I mean, they've been part of many cultures, and there many studies have been done, and today people are finding out the relevance of the status of these plants within those cultures. How do you think we could connect that to the research that are being done today, on how it could have a cultural integration? Because I think one of the specifics of these cultures is it was part of the entire family context, the entire tribe, and they had absolutely no prerogatives against them. And we're coming in a culture that had a lot of prejudices, and we have to somehow find a bridge. Do you think this is happening through research on?
Well, I think that as the more we know about how indigenous cultures used and integrated these substances, I think it will become clear how we can do it. Of course, we're in a very different context. We are trans-egalitarian societies. Much of psychedelic use in traditional societies is societies that do not have classes. Societies in which leadership is charismatic. It's not something. I mean, you don't have this. The chief does not inherit his place in society. It's because you have the capacity to cure, or you have the capacity for divination, or you can help people decide when you can go and hunt. So there are very specific uses for psychedelics in these societies, but the thing that is always there is that it's something that is ritualized. So ritual is something that is basic for the process of preparing for the experience, for having the experience, and eventually for integrating it and having it be something that is nutritious or that is beneficial for the individual and for the group. And I think there is this analogy going on in psychotherapy. Not necessarily is ritual that is done, but there are guidelines that are followed. There is some behavioral patterns that facilitate a safe space in which you can explore the inner workings of your mind, or you can explore your spirit. However you can sexualize it. But it is clear that the effect has not to do only with the neuropharmacology of the substance, that you have to carefully orchestrate the context, and your intention has to be the right intention for you to be able to really benefit from these substances. So I think maybe they can elaborate a little bit on that regarding the specific psychedelic therapy.
Exactly, Leticia.
Yeah, I mean, it's such an important piece. If you look, so many different schools of psychotherapy, when they think of how are we best going to do psychedelic psychotherapy, people tend to reflect their own ideas. So in the 60s, it was very psychodynamic, and then now I think people are looking at mindfulness or even non-directed types of therapies. But the one thing that is consistent is that there has to be an attention to the set and setting. That this has to be something that's significant, that people need to be cared for, that there needs to be some preparation, and there needs to be attention afterwards. There needs to be preparation so that people enter into it in an informed and as comfortable a way as possible. And there has to be integration because people are vulnerable afterwards. It can be a profound event. So to get the most from it, we need that. It has to be surrounded. It's psychedelic-assisted psychotherapy. And I think we have to have training for people who are going to do that. I think it can be the same or largely overlap with general training as a therapist. I don't think that it's a completely different job from being a regular therapist. I think it's a new tool for therapists. I think it will require some additional training on how to best get people in and get people out so that you have the best possible effects. Fortunately, it's still pretty safe. So the risks are there, but they're not as pronounced as some other drugs.
Yeah, I think that the integration and the support after the psychedelic experience can be given professionally, and this is part of, I think, the healing process for anyone who wants to do the work that needs to be done when we're, having some issues or just our own growth. But at the same time, I kind of always struggle with how can we give support as a community? Not only one professional gives that support on a weekly basis, let's say. How can we as a community come together and provide this best support to people and recreate at some point a certain community which we had in ancient times? It was a full village that would support the people. And I think we need to be creative in this modern society, also through technology, how we can support people the best way and not because, and I think psychedelics, one of the beautiful things about it is it connects. Like you said, it brings you out of isolation. So there is a strong need of human connection afterwards.
Sure, yes.
And I think it needs to be addressed and it needs to happen really for people. They can't go back to their isolation. Because as you said, it's a strong experience and you want to share this with people.
Mm-hmm.
And of course, it's easier to share with people that have been through similar experiences. Mm-hmm. I think that's also why these communities have to be created to give support, right?
I think group therapy models will be very promising for people, and there's actually been starting to do some studies with group work in psychedelics. As we start, we always want to do it as conservatively as possible, so it's one-on-one, often two therapists with one patient. But it might be the case that ultimately it's group integration or group preparation, or maybe people have an option of one or the other. I think surgeries give us some kind of a model for how we might think about it. You don't just go and have a surgery. You're going to see the doctor first, and you meet the nurses, and you meet the whole team, and you think about options. There's a careful assessment, maybe, and then you stay under supervision for a couple of days, maybe, or at least overnight usually. Mm-hmm. You go back the first week. You go back a couple of times. People check on you. If you're doing well, less. If you're not doing so well, there's more attention. But I think that model, we can learn from that and adapt that.
And the also a major issue is how can we provide tools for people, self-care tools, because I personally believe that we are our inner healer, we are our inner guide, and that's also what psychedelics teaches us. And that how can we create tools so people are not dependent neither on seeing a therapist on the long term. How can they develop self-care tools that can really bring them on growth and healing, right?
Absolutely.
I think that, regarding that, we can learn from the ancient cultures, right? The main tools are music and art and metaphor and
meditation.
Right, so it's like we need to regain the whole kit, right? And I think what Leticia was saying about community is fundamental, because the experience that people have in traditional cultures is not their own experience, it's not a subjective experience. In Western cultures, we tend to think that it's my experience, it's my psychedelic experience, or it's my awakening, or my whatever way you can conceptualize it. But we need to find ways to share the symbols and the archetypes that allow us to integrate the lessons that we gain from these experiences on a societal level, not only on an individual level.
It's beautiful how in holotropic breathwork people make their mandalas and share their mandalas, and there is that whole sharing aspect. And I think we can, learn a lot from breathwork around.
And it's not something very rational, or it has to do with expressing something that cannot be put into words, because the experience itself is ineffable. It cannot be put into words, so it follows that probably the best way we can communicate and we can integrate has to do with art, has to do with music, has to do with metaphor, has to do with storytelling, dancing, all these kinds of stuff that have to do with something that is more ancient, that is more, I don't like the word primitive, I mean it's evolutionarily more ancient. There are ways in which we deal with stress, and ways in which we connect with people that have nothing to do with words. Words didn't exist when all of these things were in place, right?
Absolutely.
Excuse me, I wanted to ask Leticia and Zach, do you guys think that it's necessary for a therapist that wants to do psychedelic assisted therapy that they have personal experience with psychedelics? Do you think that is fundamental? Or?
Well, I think from the literature, some researchers suggest yes, to have a certain commonality and a certain understanding. Yes, I think there is a certain agreement of yes, but there are also some researchers that say no, it's not necessary. So, what do you think, Dr. Walsh?
I think if you're to look around now, it might be a moot point, because I think most people that are doing it have had that experience, and that's what's brought them to it. I mean, maybe not. There's a part of my gut that says, yeah, people should have that experience if they're going to do it, but why? Perhaps if the technologies are developed on how to do it, then why should you have to? But I guess we can find out
that, right? There's no research like comparing.
It could be an empirical question, right? Take therapists 10 that have done it and 10 that, and then how much do they have to have done it?
Yeah.
Did you have to do it once and just, okay, I gotta get my license, or is it?
There's so many variables. Yeah. The only official training in the U.S., the California Institute of Integrative Studies, do not require any therapist to go through psychedelics to be a psychotherapist, right? So I think it's officially it's not necessary. Now I think it's more a personal point of view we can all have about that,
and
right?
with MAPS, these projects that they have with MDMA, they do require for the therapist to have experience with MDMA, right? They go through the experience themselves with. Or am I wrong?
Well, all the MAPS people have experience with psychedelics, but I don't think they really make it an official requirement.
Okay. Thank you.
If we were to follow on that track, and if we were to go back a little bit to, I think 1946, when Hoffman discovered the LSD, they are his own stories and records, and he wrote how all these doctors would get together, these very proper people. With their ties and everything, and they were all experimenting the product before going to treat their patients. So, I believe due to the specifics of the effect that those psychedelics have, it seems that to be, if it's not a legal requirement, it should be an experience that people have to understand what their patients are going through.
Yeah, I mean, there's this bioassay tradition in chemists, and then the first pharmacologists, they were using their drugs. I mean, if you're going to be using them on other people, well, maybe the first person that should try them is yourself, right? So maybe it's just...
It's an interesting question.
Maybe there should be an opportunity, and if it's something where they're only going to say you have to have PTSD in order to get MDMA, then there may not be an opportunity for therapists to do it, but maybe there should be an exemption where therapists can.
Yes.
And I think it might be a moot point. I think if we find the therapists, the psychedelic psychotherapists that are allowed and encouraged to try the medicines but have decided not to, I suppose they can form their own society. It'll probably be pretty small.
Guys, the thing right now.
But I wouldn't forbid them.
So this would be a big difference with the use of those psychedelics in history, because all the leaders in cultures were users themselves, and they were providers, practitioners, and everything.
Yeah.
So
and I think you said like you won't probably be attracted to do psychotherapy assisted with psychedelics if you haven't done the own experiences. It kind of goes together, right?
And it's a big commitment. For this is like 6 hours being next to a patient and trying to accompany him through his experience. So I don't know how many would be motivated if they don't really know what's going on during that time.
Guys, I wanted to know how is science approaching to the subject of the dosing? Like all this, we're talking about LSD, psilocybin, and all that. Like, Is there a specific strain of mushrooms, psilocybin, or what do we know about that?
Mushrooms vary pretty widely in how much psilocybin they contain across species of mushrooms and across given examples of within a species. So most of the research is using standardized synthetic psilocybin. And I would say that the doses that are effective are what would be considered, I would say, large doses from people who have perhaps experienced on their own or tried recreationally. The therapeutic doses are generally large. Large doses. There's some research showing that it's the intensity of the mystical experience that determines the outcome, and typically that's more. Sometimes you could get there with less, but it's more reliable, more reliably evoked with higher doses.
And so it's a very important point you're talking about for people who would like to work with the psilocybin. How does it work today? You were saying it's coming from one specific species more than another, and that's the one that is being used in the several studies around the university.
It's being synthesized chemically, so it's not derived, it's not extracted from the mushroom, and that way the dose can be regulated. The way it was with cannabis for a long time, it was not very reliable how much THC or what people knew or what a strain was, and very quickly when it became something where there was an incentive for that, the industry and the producers were able to get on board with it. And I imagine it'll be the same with psilocybin. There'll be synthetic psilocybin, but if they're synthetic, then why would I guess from a medical model, then synthetic might be preferred, but if the regulations are reduced, perhaps people will have easier access to non-synthetic and be able to have some reliable dosage around that if we get some kind of legalization. If it follows a path like cannabis, where it goes from medical to non-medical.
The fact that it exists such a variety of those psychedelic mushrooms in nature, do you think, Jose, for instance, that the fact of picking only one to become the cure is a limitation towards actually access to more possibilities in terms of therapeutic aspects?
Well, I think there's something similar that's going on with the entourage effect with cannabis, right? That we have a cocktail of compounds. We have biocysteine, we have psilocin, and there are many others. Actually, there's a paper that came out like 2 months ago that they found there's beta-carbolines, which are present in the ayahuasca. So they are present in trace amounts, but they're present also there. So probably nature is wise, and that's why it produces this the diversity of compounds that they work for the mushroom themselves. They have they're secondary metabolites, but they have a function for the fungi, and probably we will have different effects from just using psilocybin than from using the whole mushroom. However, I remember reading that Maria Sabina, this shaman that used mushrooms, I think it was Gordon Watson, who brought her the psilocybin, the synthesized psilocybin that Hoffman had done, and she said that it was the same, and that she could now do the rituals, the ceremonies during the time when the mushrooms were not available. Yeah. So I think her opinion is
good.
We should take it. Yeah, but chemically and neuropharmacologically, probably there are differences, but that's an empirical question. Probably that eventually will have to be investigated.
I've heard that some people thought she was being nice because he brought her a gift, and she was like, "Yeah, it's great. It's just perfect. Thank you so much. Sure, I'll use it all the time."
Sure, that might be the case.
How do people take this? Do they do teas or do they smoke it? Or how does it work for people to know?
The mushrooms specifically.
All
in
the
the studies, psilocybin studies, you mean?
Exactly. All the use is more like psychotherapy assisted psychotherapy or this kind of rituals. Let's talk a little bit about that.
I've seen in Johns Hopkins they even use like a cup, right? They give the person the psilocybin capsule in a cup, so it's a little bit ritualized. Yes. And the thing with ritual is it helps set an intention and have like
structure.
A structure. That's
safety. Structure gives safety.
Gives safety because you have you don't know what you're gonna find, but you at least have like a notion of the way of the track that you're gonna follow. And of course, if you have someone that is experienced in those realms of consciousness, then you're gonna be able to more effectively explore them. And that's the difference with psychotherapy and shamanism. I mean, I don't remember if this was McKenna that said this. The shaman. No, this was Claude Lévi-Strauss. He said that the shaman talks and the psychotherapist listens. So there's a fundamental difference. The shaman talks and he makes sounds and he enacts the struggle that he's having with the spirits to bring back the soul or something like that. But for example, in Johns Hopkins, they give the psilocybin and the person is lying there and they listen to music. And there's this very carefully curated music that this is Mendel Kaeling, I think is the researcher that's doing that, and he's been working on the perfect playlist for psilocybin sessions. So I guess that works too. As Leticia said, there is like an inner guide, there is like a Grof thought, like this orienting principle, holotropic, or that is directed to our wholeness. And the mushrooms or LSD, they awaken this orienting principle. So maybe it's not necessary that you have a shaman doing all the performance and everything, because clearly this kind of therapy works also, even though you don't have someone directly controlling the experience that you have.
People are directed to go inwards. It's a non-directive therapy generally. There can be the preparation and the integration, but during the psychedelic experience, I think that it's safe to say the therapist tries to be supportive, maybe a hand on the shoulder or check in once or twice, are you okay? But if the participants are oriented outwards, it's recommended that they go back in, relax, everything okay. But it's not a talk therapy. It's very, very inner-directed, like you're saying, the inner healer.
What about you were talking earlier about ketamine and MDMA, right? What do we know about that? We're talking about psilocybin. Let's talk a little bit further on those subjects.
Different mechanisms than psilocybin, DMT, LSD, the classic psychedelics, but they seem to be following a similar path and similar, I guess they're sort of traveling together right now. One of the things with ketamine is it's legal. It's been just recently approved as a nasal spray by Johnson & Johnson for depression, for suicide. That administration is very expensive, and it's a little bit ironic because it can be used much more cheaply as a long-standing unpatented medicine, but they were able to patent a certain mode of administration and a certain version of the molecule. That's the one that's been approved. That doesn't stop physicians from using old-style ketamine, which has the same effects, more or less, off-label. But how that works from a regulatory framework is really up in the air right now. In the US, there are many clinics that offer ketamine infusion. Some of them take a psychedelic approach. I think that's growing in popularity. Others, I think, see the psychedelic-like effects as being a nuisance. So I think some people would certainly see it as a psychedelic and as something that works in much the same way as the classic psychedelics. It's shorter acting and much more available. In Canada, there's a lot of regulation around it. It requires intravenous use for depression, and even that's off-label. We're trying to make it possible to do it in a more conducive environment where it can be intramuscularly administered, so that people just get one shot rather than being hooked up to an IV, because that can be quite distracting from the psychedelic experience. But if it can be given in an oral lozenge or intramuscularly, then people can much the same thing, the sleep mask and direction to go inside and emotionally evocative music that's not overly, no lyrics usually, but so it could be a slightly simpler to administer psychedelic. The early results for depression are quite astounding, but we still have more to learn.
And how about MDMA?
But yeah, one of the Psychedelics being used widely in recreative ways, MDMA, and here in Costa Rica there are many music festivals, and it's definitely some drugs that people are been using, but there are some very positive aspects therapeutically with MDMA. Would any of you could tell us a little bit more about that?
There's been great results so far with MDMA and PTSD. Then there's a lot of activity in that research area. I think we can expect to see MDMA approved as a treatment for PTSD in the not so distant future. The effects for people who are resistant to other forms of treatment. So there are treatments for PTSD. There's behavioral treatments. Some people have good results with antidepressants, but a lot of people don't. And some of those people, a large portion of those people are showing good results from a few MDMA sessions. So it's certainly promising, and that's being recognized by different governing bodies in the US and Canada and Europe, and I think we're going to see MDMA as a treatment. It's not a psychedelic in the classic sense like LSD and psilocybin. And like ketamine, it has probably a greater potential for misuse, for compulsive use. It can have, I think it has greater potential for misuse, but again, it's a relatively safe drug. Ketamine also is widely used as an anesthetic. It's used for children in even higher doses than the therapeutic dose, but like MDMA, it has a greater potential for perhaps compulsive use or people using it recreationally than the classic psychedelics. So that I guess that's a concern for some people. There's no evidence of someone encountering MDMA in a trial or in a therapeutic setting and then going on to have a problematic MDMA use. But I believe there are people who use MDMA and would like to use less and have some difficulty doing that. So in that way, you don't see that as much with psilocybin, where people are like, I'm giving up psilocybin, and then the next weekend they're using psilocybin again. But you can see that with MDMA, you can certainly see it with ketamine. And with prolonged use of ketamine, there can be some pretty severe health consequences for the bladder. So in those ways, there's some more concern, but still compared to many mainstream medicines, they're still quite safe, and those negative experiences are limited and haven't really shown up amongst therapeutic users.
What would you guys say like to somebody that's scared about these drugs now? Like there's people that have been raised with this kind of mentality. What would you say to those people that might be interested in it?
Well, I think fear is one of the emotions that blocks most people and important growth in our life. So I think that it's about education. We need to educate ourselves, and I think that we're talking right now under scientific rigorosity and validity. And I think we it's important that we're not gonna go back to this world where it's all like talking from an emotional part. I think it needs to be addressed that it's an educational, scientific approach that we're today. That's why it's such a revolution. Is because finally we have serious studies going on, and that I think that the education is against fear, right? I don't know.
Yeah, I mean, I think it's about a choice. People who are reluctant or who are afraid should examine the risks and benefits and make their own decisions. For many people, the concept of having that kind of an intense experience is unappealing, and those might be people who would rather take an antidepressant on a regular basis. They maybe don't want to have that kind of experience, and they should. I would hope that they would have effective options that are suitable for them. I think it should just be an option for people who maybe aren't afraid, and for those who are, if they're afraid but curious, they should find out more. And if they're afraid and not curious, they go about their business.
And I have to say that as personal experience and as a professional breathwork can be a very healthy and safe technique that can also help people having similar benefits from psychedelics, because you can enter non-ordinary states of consciousness, have mystical experiences through breathwork. So like Dr. Walsh says, I think there are many options, and I think I think people have to choose the option that feels right to them. That's also your inner guide.
And it's such a personal experience that, you know, you wouldn't want a situation where someone says, okay, you have this condition, you have to have the psychedelic experience, or you're a non-compliant patient and I won't see you anymore. So I think maybe more than some other medicines, this is something where it could be something that people seek out, or rather than something that is too vigorously recommended if people don't like it. I think that that the people who want it will find it once it's available.
Yeah, and I think it's important what they're saying, that personal choice is always important, because, for example, during the 60s and 70s, there were people that had this idea that we had to put LSD in the water or something like that so that everyone can treat and everyone will be enlightened or something like that. And the problem with that is that not everyone has the tools or the maturity to be able to gain insight and to be able to feel healthier after having these experiences. So not everyone has to have this kind of experiences, but it should be the case that those people who need it and want to have it should have the choice to do it.
Yes.
Right? I think we can all agree with that, right?
Absolutely.
Yeah, we don't want to be messianic about it. It doesn't have to save the world. Maybe it will. That would be terrific. But if not, maybe if we just have another option for treatment of people who are suffering, and if there's people who can quit smoking that couldn't quit smoking before, or people who are not depressed, or people who are dying that can go more peacefully, and all of that stuff, that's enough.
Sure.
Well, guys, thank you so much for being with us tonight, sharing your knowledge, and till next time at MCN Talks.
Thank you
Thank
for
you.
inviting us.
Thank you for coming.
That was awesome.